Introduction. In the context of present-day developments, the demand for healthcare services of high quality is increasing. In this regard, the significance of nurses cannot be underestimated, as they spend the greatest amount of time delivering medical services to patients. In addition, there are considerable problems with the accessibility of medical care among the broad categories of the United States population. The necessity to expand the role of healthcare providers is also widely discussed. The Institute of Medicine has published the report Future of Nursing, Leading Change, Advancing Health, which is aimed to address the aforementioned issues. According to it, it is essential to improve the quality of nursing education and encourage continuing it on an obligatory basis in order to resolve the current problems in the long run. Job options based on educational level. In the modern world, there is a significant demand for nurses, and it tends to increase from year to year. There is a variety of options to start the career path. Currently, I am receiving a bachelor's degree in nursing, which opens a range of job options in the market after finishing it. For instance, it is possible to obtain a position of a registered nurse. In case of receiving registered nursing license, employment opportunities of a cardiac nurse, critical care nurse, ER nurse, geriatric nurse, and a perioperative nurse. In addition, after obtaining this academic degree allows to occupy leadership and managerial positions. Furthermore, it is possible to be employed as a certified registered nurse anesthetist, clinical nurse specialist, family nurse practitioner, mental health nurse, nurse educator, and nurse practitioner. However, the outlined professions imply more in-depth training, and it is essential to receive a master's degree in order to apply for them. In some cases, it is required to finish a doctoral program, and a registered nursing license is obligatory for all these positions. Goals for professional education. The IOM report recommends the nurse to have a comprehensive education and training in their field. In addition, it insists on higher levels of education and seamless academic progression. This advice defines my education plan to some extent. It is evident that as a future nurse, I have a variety of fields to establish my career. My first goal, which I am currently pursuing, is receiving a bachelor's degree, which allows me to work in a variety of nursing fields. In addition, it makes my candidature more competitive in the current market. Moreover, I am determined to continue my training and finish a doctoral program in the near 6 years. I am convinced that this option will make me a more qualified professional in my sphere. In addition, I am willing to try myself in administrative and managerial duties. For this reason, I consider it essential to accompany my professional education with a master's degree in business. I am planning to combine this program with my major one. From my perspective, these educational options are highly likely to provide me with vital knowledge, skills, and competencies in order to become a qualified and competent specialist in the future. Competitiveness in the job market. Today, the higher level of education a nurse receives, the more competitive worker it becomes. Hospitals are interested in employing professionals who have completed bachelor program, and Linda Aiken, leadership professor of nursing, admits this tendency. She claims, while there is a strong preference in all healthcare settings for nurses to have a bachelor's degree, many hospitals in particular prefer to hire nurses who have a BSN. Conducting several experiments, Linda Aiken revealed the impact of educational level on patient outcomes and mortality rate. This explains the fact that employers are highly likely to prefer workers with finished a bachelor's degree. Therefore, completing this program will definitely make me more competitive in the market of nurses. In addition, a doctoral degree will help me achieve the highest credential in my professional sphere. The major benefit of this program regards its focus on practice, and consequently, it will guarantee high quality of my performance. A master's degree in business will be attractive for the potential employers as well, as I will be capable of occupying managerial and administrative positions. Therefore, these education paths will significantly increase my competitiveness in the job market. The code also includes the positions of beneficence and non-maleficence. Continuing nursing education and competency, attitudes, and knowledge. The fact that continuing nursing education has a positive impact on competencies, attitudes, and knowledge is undeniable in the context of present-day developments. Today, the field of healthcare is actively developing, and therefore, there is a necessity to update the knowledge and obtain new skills on a regular basis. Furthermore, this approach allows to match the requirements of the ANA scope and standards for practice and code of ethics. It promotes carrying out nursing responsibilities in a manner consistent with quality in nursing care and the ethical obligations of the profession. It is evident that it is impossible to perform these requirements without comprehensive training. A lack of education equals a lack of relevant knowledge and competencies, which increases the risk of harming the health of a patient. Thus, there is a direct connection between nursing education and the outcomes of clients. Mandatory continuing education in nursing. Continuing the reflections on nursing education presented in the previous paragraph, I should mention that I believe in the necessity for mandatory continuing education in nursing. As it has been already mentioned, it has a significant impact on treatment outcomes. Seamless academic progression and regular updating of the qualification allows to deliver medical devices of high quality and provide patient-centered care, which is the priority these days. In addition, according to the IOM report, it will be beneficial for making medicine easier to access in the long run. However, I am convinced that not only nurses, but also employers should be interested in supplying mandatory continuing education. The latter should provide the workers with a possibility to achieve higher degrees and training for improving the skills and updating knowledge. Furthermore, they should support nurses in their determination for education by supplying additional holidays for academic purposes. Thus, this approach will guarantee positive results, and the state healthcare systems will be significantly improved, as well as the health condition of the population. StudyCorgi.com has everything you need for successful studies. Writing tools, informative articles, and essay samples. Come check it out!